Okay, well, there is definitely a lot to get to this morning with Dr. Isaac Bogoch, infectious disease specialist from Toronto General Hospital, joining us as he does every Tuesday morning. Dr. Bogoch, thanks for being here. Let's start with the situation in China, first of all. There are reports now of packed hospitals and a surge in respiratory illnesses. The World Health Organization also paying attention to this. Now, Chinese officials downplaying it. But what are you seeing and thinking about this? How concerned are you right now?
Yeah, I think it's important to recognize that the WHO did reach out to Chinese health officials to ask exactly what was going on. That conversation took place on November 23rd. The Chinese health officials said, yes, we are having a significant rise in respiratory infections here, but this isn't anything unknown. These are known conditions. This is RSV, flu, COVID, and a bacterial infection called mycoplasma. They may be having something similar to what we had last year when we had this huge spike in respiratory illnesses this time last year. That may be what's happening in China, as they were rather late in lifting some of their significant public health restrictions. So that's the current hypothesis, but like anything else, we got to watch it closely. We sort of have to trust but also verify this information.
Yeah, indeed, trust but verify, so important, especially in the light of what we've seen in the last several years. And perhaps that's kind of similar to what's going on even here. There are stories about a surge in the situation west of the city, McMaster Children's Hospital in Hamilton. Kids being cared for in hallways right now, being admitted with RSV and COVID, in some cases simultaneously, both respiratory illnesses. What are you seeing and hearing locally from the infectious diseases community? Is this something that's perhaps not just isolated to McMaster Children's Hospital, for example?
Well, listen, we can expect to have a flu season and have an RSV season this year. We know it's already starting to happen if we, of course, look at what's happening at McMaster. And unfortunately, we're going to start to see more flu and RSV, not just in kids, but in adult populations across the country. If we take a timestamp of where we're at right now with flu and RSV in Canada, we're at what would be expected at this time of year in a regular pre-pandemic season. So, that doesn't mean it's nothing. That's still an issue. We're starting to see more and more flu, more and more RSV, but it's at what seasonal levels would be expected at for late November. We are going to see more of it, though. It's only November. Of course, we have a long winter ahead. And of course, on top of RSV and influenza, we know we have COVID as well. And COVID rates have been climbing and waxing and waning since the tail end of the summer. So, it's going to be a long winter, but hey, we've been through this before. We know exactly what to do. We have flu shots that are widely available. We know COVID vaccines are widely available. People can obviously lower their risk of infection by putting on a mask in an indoor setting. In the absence of mandates, that's a choice, but certainly many people are choosing to do it. You're starting to see more masks out there these days. And we'll get through this winter like we've gone through the last.
Okay, and you kind of alluded to what I sort of wanted to touch on last, of course, that being the top line COVID-19 numbers that we're seeing from Public Health Ontario, the wastewater data showing that we're sort of back to, and like you said, it's very seasonal. This is right back to sort of mid-November numbers of last year. Highest we've been to. Chances of exposure appear to be pretty high these days. We're moving indoors, family gatherings, holidays, etc. All of these sort of, it's kind of like that perfect storm, isn't it? It's happening right now. So what's your sense of like where we should all be? I mean, is it just like have your mask at hand? Like what would you be advising people, and you obviously have a big audience right now, when it comes to the fact that COVID is back, percent positivity test rate 20% right now as well?
Yeah, I think we can expect COVID to look this winter very similar to what it looked like last winter. Obviously there might be some differences and there's always some curveballs thrown in there, but we're not going to have a winter like 2020 or 2021 from a COVID-19 standpoint, where a single pathogen imploded our healthcare system across the country. Oh, it's still there. It disproportionately impacts those over the age of 60, especially those over the age of 70. We know these are people, we know what the risk factors are for severe illness. It's especially important for people with risk factors for severe illness to get that COVID-19 vaccine. You can put on masks, of course, in indoor settings to reduce the risk of not just COVID, but other respiratory infections. Influenza vaccines are free, widely available for everyone 6 months of age and up. And again, stay home if you're sick. Don't send your kids to school if they're sick so that they infect others. And, we've got the tools for success, and we'll get through this.
All right. That is reassuring indeed. Dr. Isaac Bogoch, always appreciate the time. Thanks for joining us again this Tuesday morning.